Alrighty, so the issue that I'm going to be addressing today is the issue of physician burnout. So this is just a little roadmap about what we're going to be discussing today, mostly just what is burnout, the role of burnout in healthcare, what causes it, what are the consequences, and then some solutions. Alrighty, just starting with the word burnout itself, I know you guys have heard of it before. It's definitely gained a lot of traction on social media, especially with the upcoming or uprising of the pandemic, as well as just the mental health movement. But the word burnout wasn't even coined until about the mid-70s, and it was simultaneously coined by Herbert Freudenberger and Christina Maslach. Freudenberger was in Florida working with drug users, and fun fact, in the 70s, burnout was a slang word for drug users. And when he noticed just him and his colleagues felt this just feeling of hopelessness, despair, frustration, being emotionally drained when trying to support these mentally unwell people. And then on the West Coast, we have Professor Christina Maslach. She wrote an article in the 70s describing the feelings of burnout and finally giving it a name, and received so much feedback from people who felt the same way but never had a word to describe it. And then Maslach then went on to pursue a lifelong journey of researching occupational burnout, and even created the MBI, which is the Maslach Burnout Inventory, and that is used to this day to quantify the amount of burnout that someone might be feeling, which I thought was just super cool. And then I included Christina Maslach's definition of burnout, which she described as the response to excessive stress at work, which is characterized by feelings of being emotionally drained and lacking emotional resources. And then I also included a definition by the APA Dictionary of Psychology, which said that burnout is the physical, emotional, and mental exhaustion accompanied by decreased motivation, lowered performance, and negative attitude towards oneself and others. So burnout is typically caused by stressful conditions, working long periods of time with no time to recuperate, and as well as just pent-up frustration and emotional exhaustion. And when left untreated, can lead to other issues like depression, anxiety, suicidal ideation, emotional exhaustion, depersonalization, and reduced feelings of personal accomplishment. And exhaustion and fatigue in specific has led to a significant increase in unprofessional patient interactions, clinical error, and errors attributed to miscommunication, all of which can be dire in a situation such as urgent care or ER. And then as a pre-med major, I just kind of want to talk about how this perpetuated standard that's kind of unspoken about in the healthcare community, that success comes at the price of personal happiness. You're supposed to be okay with missing out on these formative years of college. A lot of people say that you lose your 20s to med school. And to a certain extent, I would agree, but I don't think it has to be that way. And this is just seen, especially this kind of sacrifice is seen, especially in the statistics that undergrads are supposed to achieve to even have a chance at going to medical school. Having a 3.8 GPA or higher, that 1512 MCAT score, having over 1,000 hours of volunteering, having your own personal interests in being a part of student organizations, shadowing physicians. Things are crazy. And then being a resident is given a salary to pay, and they work over 80 hours a week, which when you do the math is about $15 an hour on average. And then they're only given 2 to 4 weeks of scheduled vacation that they don't even get to choose, which is just wild. That's wild to me. Anyways, just a few statistics about burnout in healthcare. By 2030, the United States is predicted to have a shortage of 50,000 to 120,000 physicians. And this number is growing. And then, of course, there's stats on the bottom I'm sure you can read. I believe in you. Over 50% of residents are plagued by burnout, and over 400 doctors a year are committing suicide, and these are stats by the AACEP. Now, what do I think is causing burnout in healthcare other than these ridiculous expectations? I would like to think that it's the monetization of healthcare, and starting with the main issue, which is EHRs. EHRs are electronic health records, And they were implemented in the early to mid 2000s. And now, if you refuse to use them, you're penalized, like heavily. And the purpose of EHRs was great. It was to increase workplace efficiency, to just enable sharing information like privately and securely, to help prevent medical errors that could be caused by, manual error, and reduce paperwork. But EHRs have their pros and their cons. Pros, of course, easy distribution of info to patients. You get to see your vaccination records online. You literally get to see every single health record since you were born on a screen now, which is kind of sick. Very cool. You don't lose any more papers, or at least you can reprint them out, which is pretty cool. And it's really easy to get a hold of people, especially with all the information that you have to collect. I could call your mom, you, your dad, your grandma, anybody who's on there. But there's a lot of cons too. It's very time consuming to update charts. And they're very prone to data leaks and very difficult to learn because most EHRs are very poorly coded. I don't really get why. Um, and then a lot of extra time is actually spent collecting that info. When intaking a new patient, you can spend upwards of 30 to 45 minutes collecting just basic medical history as well as insurance information, social security, address, phone number. It's crazy. Um, and just the time allocated to each patient isn't enough time to technically just treat diseases, chronic sickness, that kind of stuff. EHRs are speedy, but they're not that speedy. That time that was gained from the conversion from paper to electronic has now been put back into data, just intake and output, especially like insurance information takes a long time. Um, and just a few ways that I think we could resolve this. I think we should hire more nurses, medical assistants, and CNAs to further distribute just that workload that is put onto physicians. We should definitely make appointment times longer. I think that would reduce the amount of work that doctors actually do take home. And I think providing and encouraging resources like CBT, which is cognitive behavioral therapy. I think we should really just negate that stigma that success comes at the price of your own happiness. Some ways that you can help is just becoming educated on the issue. Education is the first step towards change. Lobbying for change to both Congress and the ACGME, and just showing our support to our healthcare providers. Thank you for listening.